I'm gonna tell you a secret about myself you didn't know before today. So I'm like, I have to go overseas. Guys that come across this great nation that believe in me, serve under me, and I decided that I'm gonna go. Well, a month and a half in, we get a phone call from the village elder. He says, hey, we got some roadside bombs in the village. You guys can check them out. So we do that. We go out, and we went over the ground not once but twice. Nothing underneath it alarmed us. I took my backpack, about 125 pounds, off my shoulder, and I go to set it on the ground. When the bag hits the ground, though, you see underneath it was a bomb. When the bomb went off, I took my right arm, right leg off automatically. I get thrown left side of my face, right? I roll over my back. I see the aftermath of what's happened. First thing I had to do is start setting some real goals. So the first thing I want to do is be able to feed myself. After that, you know what? It was time for me to start walking again. I realized life's going to be forever changing. There's always going to be something that you have planned out, and all of a sudden you have to have a new direction. Embrace that change. And no matter what's scary or seems impossible, always push through, because it's going to get better if you make it that way. But every day, I wake up thankful that I'm still here with my family.
Welcome, everybody. What an unbelievable video. What an unbelievable man. Looking forward to hearing more at our Empower conference from him. And now I want to join everybody for our Battle of the AI Bots, bridging the gap between providers and payers. If we can imagine a world where healthcare providers can diagnose complex conditions with pinpoint accuracy, where administrative tasks no longer drain valuable time, and where payers can process claims with unmatched efficiency, all thanks to the power of AI. This is not the future, it's happening right now. Again, thank you for joining our LinkedIn Live chat. I'm Kate Eshelman. I'm the VP of Clinical Informatics at Inovalon. I'm also an internal medicine physician, so you'll hear me talking about my times in clinical medicine. I practice both primary care and hospital medicine. And today we're diving into how AI is bridging the gap between providers and payers and revolutionizing the entire healthcare landscape. Whether you're a provider or a payer or simply passionate about the future of healthcare, you're in the right place. So let's explore the real-world impact of AI and what it means for all of us. And now I'd like to introduce our panelists. Todd, would you like to introduce yourself first?
Sure. Thanks, Dr. Kate. And my name is Todd Crosslin, Global Industry Principal for Healthcare and Life Sciences at Snowflake. Say hello to my llama friends behind me. So, but have to thank Inovalon for having us. Great. I love that video as well. Very much looking forward to attending and participating in the Empower conference. Snowflake is going to be joining other Inovalon partners like Oracle, AWS on a great, keynote panel with Rajesh, Inovalon CTO, and Nick, your Chief Marketing Officer, but tons and tons of content that'll be phenomenal. So looking forward to this conversation today, and thanks again for having me.
Thank you. And Joe, would you like to introduce yourself?
Yes, thank you, Kate, and thank you for the opportunity to join the discussion today. Hello, everyone. I am Jocasta. I'm a clinical pharmacist by training, and I serve as the Vice President of Business Ops and Strategy here at Inovalon. I provide leadership to our Vigilance product suite, where we are focused on empowering clinicians and driving patient safety through real-time data and clinical insights. I'm really excited to be a part of this panel today, really discussing artificial intelligence and how we are transforming healthcare by bridging the gap between providers and payers. So again, thank you for the discussion.
Thank you. I couldn't ask for two better panelists. We've got the clinical pharmacy and technology perspective from Joe, and then we've got the data perspective from Todd. And we know that all of those variables are equally important as we set out to really fix a lot of the problems and inefficiencies that we see in healthcare today. So Joe, I'd like to start with you, showing my provider bias maybe a little bit here, but I spent a lot of time working in a hospital. I know that, we talked about things like drug levels of a patient and getting that information in a timely fashion can, delay someone's discharge and cause lots of inefficiencies. And that's just, one thing off the top of my brain where I think AI, plays a role. So maybe you could tell us a little bit more specifically about kinds of experiences you're having with AI and the value that it's providing.
Yeah, absolutely. So at the heart of what we do is a commitment to empowering clinicians and improving patient outcomes. And we understand that patient care is really more about just making diagnoses, like you said. It's about making accurate and timely decisions that lead to better health outcomes. And by utilizing rule-based AIs, we're able to just do just that. We can utilize this technology, intertwine it with real-time EHR connections, and make meaningful outcome changes. A great example of this is the Vigilance Pharmacy Surveillance tool, which helps to support clinicians in optimizing medication management. And by doing this, they're able to improve, let's say, antimicrobial stewardship. And we can see a reduction in the use of antibiotics and antivirals, reducing the number of days that patients are and that can help to combat, super bugs and other adverse events that could be associated with using these different medications. So one of our systems saw a reduction of 23 antibiotic days per every 1,000 patient days. So that is vast, and really being able to reduce the burden and the utilization of those medications, and making sure that we don't create resistance bugs out there in the world. So that's just one nugget of what our AI technology is able to do to support clinicians and to help patients.
And that is such a great example, Joe, because, you mentioned superbugs, right? So when patients come into the hospital and we think they have an infection, we often start kind of broadly with different things until we kind of narrow down through diagnostic tests and the behavior to figure out what exactly the patient has, and then what is really the one or maybe two medications they need rather than the 4 or 5 that we start when they first get there. And being able to make that happen more quickly, you decrease the chance of superbugs, right? Because if you have somebody on antibiotics that it's an antibiotic they don't need, or an antiviral, or any case, then you're raising the chance of superbugs. And superbugs in a hospital is very serious, right? Because there's people down the hall that might be vulnerable. So it's even bigger deal in the hospital than it is out in the community. And then you think about the cost of the antibiotics, and the fact that antibiotics, if it's something that you don't need and it causes harm to the patient, and they could have been off of it a day or two earlier, makes their kidneys a little injured or something like that, then, again, that's patient safety as well. So super great example, just one example of how the AI can really hone in on those issues and really make sure, because the docs are busy, the nurses are busy, everyone's doing the best they can. And I think that the role of the AI here is really to prompt them to do something quickly so that other things down the line don't go wrong. And I think that's a fantastic use of AI. Did I sum that up pretty well, or are there any edits you'd make to that?
Yeah, no, I think that's great. Yeah, and one of the things too, so it dovetails into this, if we're going to stick with the concept about, infections. So there's the treatment of infections, and then there's the detection of infections too, just like you mentioned. And so how do we incorporate AI for that component of it? And we see that with our infection prevention tool, where it can monitor for when clusters are happening, when us being able to implement the proper isolation protocols at the right time, even as simplistic as hand hygiene monitoring. So all of these different elements where you can utilize these smart technologies to elevate that care and reduce that mental burden for our clinicians. So you're right, it's amazing work, and it's we're only at the forefront of it, and so it's so exciting to see and to think about what's to come.
Yeah, and I can point to my own hands, the advanced aging from all those years of washing them. Todd, we haven't forgotten about you.
Oh, no problem.
And we want to talk about, so this is really kind of, we're talking about the point of care, right? How that information gets to the providers. But really, in your world, it's more about making sure that the data is processing promptly. So talk a little bit about how AI plays the role in sort of the data management side of the world.
Yeah, and I'll kind of use the example that was given, and let's go underneath the covers. How did we get that to point of care? What work went into that? And I think it's a really fun time. We all know the hype cycle around Gen AI, and I think we're kind of getting over that hump, and we're actually seeing real utilization on Gen AI. But also, don't forget about traditional ML and just traditional analytics, advanced analytics, and what have you. So what we have now is a larger suite of capabilities that allow you to do these things, and to do them beyond, forecasting length of stay or doing sepsis, right? We've heard all those things, but Joey just brought up newer use cases. So what I'm getting to see and loving to see people like Inovalon do, and your peers, is that now we're starting to see an acceleration of the deployment, right, of ML, AI, and it's actually getting more real. To do that, you've got to have a very strong data foundation. I've really enjoyed watching Inovalon be committed to that quality data foundation, which then gives you the platform to accelerate AI and ML. Without that foundation, it's trash in, trash out, number one. Number two is the fact that what we've committed to is democratizing access, right, to these capabilities. So you hear about Snowflake Cortex. It's all about, data scientists are phenomenal, but they don't grow on trees, right? So they're very limited. They do phenomenal work in building models and what have you. But now with certain functions that Snowflake and others do, we're able to bring more clinicians, more capabilities to creating ML models and doing generative AI on unstructured data, multimodal data, than what we've ever been able to do before. So to me, that underlying big increase in technology capability and the ability to bring that access and democratize it to a very good subject matter expert that can interact with a model in a much, much more modern way than having a data scientist have to pore over that months and iterate. So our speed to insight, I used to say the speed to insight's a lot faster just for traditional, right, BI and what have you. Now we're getting a speed to insight on the ML and AI side that we just didn't have before. So that's what gets me excited about working with customers like you guys, is to see this actually happening, right? Being a former Snowflake customer myself years ago, I had a glimpse of this, but now it's really awesome to see it happening.
Yeah, and so important, the data behind the scenes. If it's not good and if it's not easy to access, right, then it really slows down the progress of different use cases that we can put towards AI.
Absolutely.
We had a great question. I want to encourage questions from people viewing this LinkedIn Live, and we had a question about what do you guys think about the role of AI in improving interoperability between different healthcare systems? So we know that there's a lot of different healthcare systems. When I worked in the city, take a city setting, there's lots of different hospital systems that the patients might be brought to one by ambulance one week and then a different one, based on, if they're on reroute or they're in a different place. So it's a very important topic to talk about how, interoperability is a very important topic in general, but any thoughts on how AI can really help the challenge of getting that information to the right people at the right time?
Yeah. And I can start with this, and then I know, Todd, you could talk about this all day, but I think
it's important. I mean, it's really important.
Yeah. For AI to truly make an impact in healthcare, it must be a part of a system where data flows freely between different platforms. And I think that's why interoperability is so critical. I know at Inovalon, we've been to work seamlessly with EHRs and other clinical systems, really to ensure that clinicians have a full real-time view of patient data. And when the information is connected and accessible, the clinicians can make better and more informed decision. But without this level of connectivity, the power of AI really is limited. And so I think that question is, spot on, is that only through interoperability can we really harness AI's full potential to deliver that safe and, high quality care. So, that's just kind of my thoughts about it. Todd, you can kind of take over.
Yeah, it's the interoperability thing is always a fun conversation. I try to stay off my soapbox a little bit on this, having been in this for decades, right?
Yes.
I think one of the key concepts here, what AI does in making, so we can talk about who's going to share and whether they're going to share and all of that. But I think what Gen AI brings to it on the positive side, but there's also a burden. So I want to go to the positive side is multimodal data, right? So being able to create summaries of a lot of unstructured data now unlocks that data to be interoperable. So that's step one, right? So before, when we think about sharing data, it's been very structured, right? Whether that's HL7 feeds and FHIR and all of that, that means that data has been brought into a very structured format. So that's where we've been somewhat limited. Yes, we share CCDAs, but then someone's having to read all of that, and then you got 50 of them. So obviously, Gen AI is going to say, okay, I'm going to take this unstructured data and I'm going to now summarize it, or I'm going to pull and I'm going to glean insights out of that unstructured data. So now when I share it, now I've now shared even more valuable data. So I think that's one. But we have to be careful, and this is where data lineage and data provenance comes into play. Okay, so I just got this information as part of interoperability. Where did that come from? So we have a responsibility to do data provenance to be able to go back and say, where did this summarization come from? What if I'm questioning it and I need to look at the source and I need to go read, right, those clinical notes or what have you? So you can't have one without the other. You can't just create a summary and then assume that it's right. And we can talk about hallucinations all day and all that, but we're here, right? And the value is tremendous. So we want to give the clinicians access to it, but how do we do that in a responsible way where we can go back and trust, right? But verify and go back to the source. So I think that's kind of the key to it. And again, we could spend hours on, are we sharing the data like we should and all of that. Sure. I'll add one last piece. And I think what's important for us overall in interoperability is that we have to look at why are we copying all this data? And I look at now the realization of full human genome sequencing and the fact that that's a lot of data. I think pushing that through an API pipe is going to be really, really difficult. But the value in all of that, let's say genetic variant data, is tremendous. So as a patient moves throughout the healthcare ecosystem, how do we make access to that data interoperable, right? Without trying to make a copy of it all over the world, which has all kinds of security risk and privacy risks and what have you. So, I'm very encouraged, right? And by what we're seeing in how AI can bring more data to the table. But the more data we bring to the table, do we have the right plumbing in order to make that accessible? So I think that's the challenge.
And I think those are fantastic points. So, you talked about, we all know that a lot of EMR data is still very unstructured. And there's a lot of really important stuff. There might be, a paragraph the physician has written that details the side effects the patient's having, nausea and vomiting from the drug that they're on, and talks about they're going to discontinue that. That's really important information that can get lost easily as you push it into discrete data. So I think what you're saying is using AI to summarize that and basically be able to send a discrete snippet that says, hey, this patient, it might not make it as an allergy, right? So it might just be that they had a nausea, vomiting, and I'm stopping this medication. And that's really important for people down the line to know. And rather than sending the entire XML blob over, we can really focus in on that synopsis, but with the link to the physician looking at it, that they can say, why is it telling me this? I need to see the source. And I think that is really important, one, to build trust with the provider community around AI, but two, so that they can have it and they can see it with their own eyes if they want to read the full thing that got summarized. And then the other point about, you could send the entire, genome, right? Or you could send like, hey, this is the relevant pieces of, Dr. Eshelman's genome that you might want to focus on as you're treating her. And those are two very different things.
Exactly.
And one is a lot easier to transmit than the other, for sure. And obviously you don't want the security, and also just the massive amount of data of the human genome passing around every time, when you're really just trying to say, hey, she doesn't tolerate this, she's missing this liver enzyme, or whatever you're trying to communicate across. Yeah. So I think that that's really important. And, one thing I always caution, I think we all do, is that, just because we have these AI tools now that we didn't have before, doesn't mean that every situation requires an AI tool, right? We have to be thoughtful. I could slice my bread with a chainsaw, but I choose to slice my bread with a bread knife because really it makes the most sense. Both will work, but one might be overkill. And so, I think we have to be very thoughtful about, and that's what we're hearing a lot, that the AI use cases today in 2024 are fitting a very narrow but effective use case. They're not trying to solve everything for everybody. That brings me to our next question, which is near and dear to my heart, around the role AI can play in reducing provider burnout. So, provider burnout was bad before the pandemic. EMRs, while, I grew up in the world of handwriting, and you can't read any doctor's handwriting, and we all transitioned to EMRs, and EMRs can be frustrating for providers. There could be different things they have to fill in that annoy them. We talk about the alert fatigue and how, everything causes seizure, coma, death if you mix two drugs together, and you get kind of numb to it or blind to it. So there was a lot of provider burnout prior to the pandemic. Pandemic certainly heightened it, made things a lot worse. But there are a lot of initiatives focused on how the EMR tool can be improved and other tools can be improved so that the provider is spending less time in burnout in front of the computer trying to get the stuff in. I think we've already hit some of those, right? So Joe, you talked about some of the ways that the software can work with the EMR to kind of let the provider know they need to do something so that they can quickly execute upon that. And that's really important. I think one big role I've seen out in doing reading and preparation for this was, the provider inbox, just having a tool that's really helping the provider prioritize that inbox, because that is, a big burnout factor for providers, that there's so many messages, and are there any that could be rerouted to somebody else easily, or even someone that are straightforward that could be automated. And so, Joe, I'll ask you first, and Todd, please chime in, but, where is AI really reducing the provider burnout? And maybe where do we see this going in the future? Because this to me is a red light flashing like danger, because providers are really, really frustrated with the amount of time that they're spending in front of computers.
Yeah, you're spot on with that one as well. So in healthcare, the focus should be on treating and caring for your patients, not on the overwhelming burden of administrative tasks that are out there. And so I am really passionate about this as well, of how do we help clinicians reclaim their time so they can dedicate more of it for patient care. And that includes simplifying workflows and automating those tasks by standardizing processes and improving patient safety overall. How can we shift that focus? So, and when you think about it, when clinicians spend less time navigating through these complex systems and more time on patient care, that improves the quality. We saw that with our tools. We saw a reduction from 14 hours to about 4 hours on acknowledging high priority tasks and needs. So being able to properly triage, talking about the inbox, properly triaging what's in that inbox, pushing forward, that red, yellow, green level of priority. And so you're able to reduce the noise, increase your efficiency. And when you have that, you feel like you're not fighting this uphill battle, right? You can get things done, and that de-stresses you. You feel like you've been able to accomplish things throughout the day. And then when you go home at night and, before you fall asleep, you're not worried that you missed something critical, that you might have harmed a patient, that you might have forgotten about a patient. You have a tool in the background assisting you. And, in this thought process that AI really is, from a thoughtful perspective, it's focused on enhancing, not replacing clinical experts. So how do we get more of that enhancing and empowering aspect of it? I think that part is one that I'm really, attuned with, of how can we use AI to do that, and machine learning, NLP, to really bring the right information at the right time to the clinician.
Absolutely.
Yeah, I was going to say, so, there's in the new flashy things, which are massive, can have massive impact. There's not a silver bullet. So the flashy item is your ambient AIs, and all for that. And I see a huge future in let's stop typing and let's just record conversations and let's summarize them. But that is a significant improvement. I think everyone would agree that when we get that, nothing will ever be perfect, but there's a huge value in that. So that's on the Gen AI side and what have you. But don't forget about, again, I'm going to go back to, right, Gen AI is great, but don't forget about ML models. Let's look at models across a health system. Let's look at the burnout. Let's utilize our data scientists and our tools to identify, to your point, processes and what have you. And then even going back to traditional business intelligence. In all of that, what I've seen and the beauty of what platforms and cloud platforms do is allow experimentation at scale. And sometimes what I hear is that people will try something and there's success, but they don't iterate on top of it and they don't scale it. It's like, oh, we're doing a pilot project to try X, okay? And then they're like, oh, that was a neat pilot project. And then where's the scale? Where is the embracing that change and then taking that across a health system, right? And so that's kind of been I've seen it work well, and then I've been frustrated by some people kind of dipping their toe, but then not following through. And I'm like, you have great potential there to really create. And part of this is, how do you measure the value, the ROI? This gets into, right, as clinicians, how do you value the ROI of patient health? It's like, okay, but here the ROI is decreasing burnout. We all know there's inherent value in that, but sometimes people struggle with the measurement of it. And so measure it, right? Ask, right? Simply, what is don't just look at the raw numbers of less hours to do this or more efficiency here, but how do our clinicians feel, right? Do they feel less burned out? And that is happening to a certain degree, but I think we could do it more. So.
I love that. That is truly the outcome you want to look at, and sort of the leading things like decreased time all build up to that. We had another question about ethical considerations in AI and healthcare. I think, Joe, you kind of hit it well, where we're really trying to use AI not to replace humans, but really to help them triage their time, help them take a task that might take them, 5 steps, then make it 1 step, right? And different ways to do that. So, definitely, I like to say, AI with human oversight is where we are and think need to stay in some areas. So do you guys have any other kind of thoughts and comments around just kind of the ethical considerations of how we apply AI in healthcare?
Yeah, and I would just add on to that. Todd mentioned it before about being transparent about when AI is being utilized. So you have that as a part of the decision making, and doing the thorough testing in the background, ensuring that these models are that their accuracy is being measured, that you're continuing to refine and train those models for all different areas, and then the information, the health equity aspects of that. So including in those training models, documents and areas that affect all of the different populations. So, looking at the differences between, rural urban areas, the difference between different racial disparities and components, making sure that you're not having any undue biases within the entire system. Just all of those different levels and being thoughtful about that helps to bring up the ethical needs and making sure you have a panel, that's doing the governance for the AI and the utilization of the AI within your organizations and your healthcare system.
Yeah, I can have that. I mean, I get to see this. I'm fortunate enough to I spend a lot of my time in the crossover between the healthcare and life sciences ecosystems. And I can truly say that, it's not just buzz, it's not just talk. I am very encouraged by efforts being done by certain people to remove that bias and to hit populations that prior have not been touched. So that's the great part, right? That's the great news. I'm not saying we're not there, right? We can't, spike the football yet, but it's real. And I think that's what I get to see. And I see it I'm a data geek myself, so I enjoy digging into this type of data. So there is, real efforts around clinical trials and what have you to make sure that populations are represented that have not been represented. Because, right, biased data produces biased models. Right. I mean, it's just I'm not calling it trash in, trash out, but it's limited in, limited out. Right. And can be deceiving. And then when you try to go after a population with a therapy or what have you, you can cause harm. And that's obviously what has happened. So I'm just in general, I'm encouraged by what I see, and I'm looking forward to seeing more of that and have broader applicability. So it's, I'm just generally optimistic about that. I'm maybe in the minority there, but I guess, staying out of the politics of it and all that, it's like, it's happening. Right. So I appreciate that we're seeing that happen. So.
Yeah. I think the more awareness around, social determinants of health that we've had in the past 5+ years is really helping make sure that the AI integrity is good as well. We're about at time here. I want to ask both Joe and Todd, kind of if people don't remember anything else from our talk, or what do you really want people to take away from this conversation as they continue their journey learning around how AI can really help out in healthcare?
Joe, go ahead.
Yeah. I would say, if you took one thing away, I would say that the EHR is not enough, really, that we need AI tools that are highly adaptable, that can allow healthcare providers to address the unique challenges that their clinical environments may play out. So, as these new challenges arise, how can we give clinician the tools they need to quickly adapt, all while keeping patients safe and healthcare quality very high? And with that, we need more. And so I love this conversation. I love the tools that we're creating, and continuing to have these conversations. And I know we're going to talk about it more at Empower. We have a whole panel on this conversation there too. So I think just, continuing to remember that, EHR is not enough, that we need more AI tools to really take us to the next level of patient care. Todd?
Yeah, no, to me, don't allow the speed of change to dissuade you from embracing these tools, right? There are some, I hear this out there and people are like, it's changing too fast, right? I don't trust it. And I think, where we've gone and my peers and cloud technologies is we're providing platforms that we're bringing in that change. There's a new model out every week, right? Llama 3, I'll have 4 llamas back here, or 15 llamas by, a couple months from now. So the point being is that, right, these things are going to change. Our role, right, as platform providers is to abstract away the complexities of that rapid change. And then for organizations like yourselves and your peers is to create, right, solutions, but then it's okay if some of the underlying technology is rapidly evolving. Our job is to abstract away and allow you to build value on top of it. And that's what we're seeing, which I think is great. So going back to that, experimentation at scale, allow yourselves to dig into it, right? And to put forward solutions out there and allow yourself to iterate faster than what you might have in the past. That's what we're hopefully we are providing, and we're seeing it. Is, I guess my last point is, don't be afraid, right? Like it's not a technology to be afraid of. Embrace it, right? Be transparent. I think is an awesome point there, but embrace it, right? Enjoy it.
Thank you. And I know we're at time. I want to let, we've got other questions from Kaisia and Rosina. We will get back to you in the comments section, and really want to thank my panelists for joining. And if you want to hear more about these conversations, please join us at Empower. And thank you, everyone. Have a great day.
Thanks, everyone.
Thank you.